Hello, this is Raj from Edifecs. I head the advisory services, and today's topic is interoperability, also known as smart trading. As you all know, the U.S. healthcare is under a major transformation that is going to cause ripple effects in the delivery of care, cost, and also the quality of some of the outcomes. In the last few years, we have seen several initiatives, such as the Accountable Care, the HITECH Act, the exchanges, the ACO programs, the shared savings programs, and also dual eligible programs. All these programs have their set of objectives and goals, and to a large extent have been running in silo. As a result, what we are seeing is health plans have been running several clinical initiatives to meet certain objectives for various stakeholders in a very fragmented way. So these initiatives have been running to a large extent in parallel with their set of objectives. And what has happened as a result is several infrastructure that have been created to meet these objectives. And there is a clear demarcation of the outcomes and the objectives. What we are seeing because of these market forces, whether it is accountable care or shared savings program, a greater need for collaboration between the payers and providers. And at the very foundation of these collaboration is an infrastructure to exchange information very efficiently or effectively, and this is what we call as interoperability or smart trading. There are also enough evidence from some of the industry experts that by 2025, there is going to be a surge in clinical data from various instrumentation devices. Not to say to support some of the value-based care programs, you need an infrastructure to support clinical data. And these clinical data, whether they are HL7 or ADT, are more complex than the traditional admin data or the claims and the enrollment data. So now let's step back and see where did we start? Where are we today? And what should health plans be doing in terms of investing in the right set of infrastructure for smart trading or interoperability? As you all may recollect, we started off in the X12 or the 40-10, 50-10 world, where the focus was primarily to exchange EDI information. We had a pipeline in place that exchanged claims data, that exchanged enrollment data, and there were a bunch of companion guidelines and rules. But that did not really solve some of the inefficiencies across the ecosystem. So the next one where we are seeing a lot of the health plans today is the interoperability governance. And when we talk about interoperability governance, it's around visibility to transactions that come in, whether it's claims, enrollment, authorization, or the claim status inquiry or the eligibility inquiry. What we've also seen is some of the health plans have taken advantage of the interoperability governance to address the admin inefficiencies, or what we call as the reduction of ALR, a critical piece in the post-reform world. And by doing certain things upfront, you can improve the first pass rate or the member effectuation or group installation process. The third step is the process governance. When we talk about process governance, we refer to the process across entities, whether it's payer, provider, or clearinghouse. Some of the key process governance initiatives are the CAQH, which focuses on member eligibility, claim status, and remittance transaction set, and also the uptime, downtime of the supporting systems to meet the required business SLAs. Some of the emerging trends we are seeing in the interoperability for value-based care is maximizing your existing EDI infrastructure. This includes using the existing EDI pipeline to bring in clinical data and using EMPI services to uniquely identify members and their corresponding claims and clinical data that can help create patient journal or a member journal, which can be not only used by the payers' care coordinators, but also by the providers in ensuring the right set of clinical decisions are taken and the patient satisfaction and outcomes are met. The Edifecs advisory team works with a number of national and regional health plans in defining clinical ingestion strategy to support the value-based care programs. The team identifies use cases, the ROI, and supporting return on value or return on asset on the critical infrastructure to support the value-based reimbursement or value-based care programs, both short-term and long-term goals. The details of the team is shown on the screen.